The Neuroscience Institute recognizes that epilepsy is a significant problem that requires, an accurate diagnosis to direct therapy, and to create the infrastructure, which is child neurologists, specialists in epilepsy, specialists in neuroimaging, actually looking at the brain, and to have a facility where we can bring children in, we can monitor them as inpatients. I think the Neuroscience Institute saw this as a goal and as a real need for kids in the state, and so they've really provided leadership in terms of helping us establish the program. The Barbara Bush Children's Hospital has been very enthusiastic in helping this become a reality.
We are developing an inpatient monitoring unit, which will dovetail with outpatient care of these patients, evaluating them for better seizure control as well as potential neurosurgical correction.
Epilepsy is more than just seizure control. These kids also have learning problems. These kids sometimes have anxiety, depression, which can certainly affect them, affect their quality of life, affect the family. And so there are lots of different areas in epilepsy that we're starting to realize are important to address.
My daughter was a difficult child from birth. I got a call from her teachers one day that she had lost all of the color in her face and had gone very pale, become non-responsive. I remember at one point saying to her pediatrician, is there any possibility she's having seizures? Because some of the behavior that she was showing was very similar to behavior that I had seen in my sister growing up, with my sister having epilepsy. It was very frustrating as a parent because, I always tell everyone, as a parent, you know if something's right or something's wrong. We pushed a little further, and it was at that point that the pediatrician decided to refer us to a pediatric epilepsy group in Portland. And that's where we had an opportunity to meet Dr. Morrison. I finally had validation. I finally had someone who had taken the time to listen to what we were saying, to find the right test, and to help us get where we needed to understand what was going on with Meredith. Even though we're living in Connecticut, I've chosen at this point not to take the children out of Dr. Morrison's care.
I'm proud of the enthusiasm that other people involved in this program have had. The EEG technicians, the pediatricians and pediatric residents that I've been working with, the nursing staff at Barbara Bush Children's Hospital, and my colleagues at Maine Neurology, who are all, I think, really enthusiastic about trying to provide the best care that we can for the patients that need it.